In doing the visual observation for patellar tendinopathy, we can just compare the affected side to the unaffected side, looking for changes in the quality of the muscle tissue and or whether there's any muscle atrophy on the affected side. Especially in chronic cases of patellar tendinopathy, the athlete has had to unload the affected side because of pain, and over time will lose some muscle mass as a result of the sort of underuse of it, if you will. For the resisted test, we are going to have Sammy do resisted knee extension. For our demonstration purposes, we've already tested the unaffected side. Now we'll do resisted knee extension on the affected side. This is an isometric contraction, so this is really focused on the muscle tendon unit as opposed to other structures in the knee joint. She sits with her thighs fully supported on the table, the knees bent to 90 degrees. I'm going to add resistance by holding her at her tibia. So not on the foot because we don't need to stress the ankle joint during this test. So for leverage, I'm just above her malleoli. And you're going to start slowly and try to straighten your lower leg. Start slow and then keep pressing if it doesn't hurt. If she has pain during this test, that's a positive test. We would stop. If she doesn't have pain, she's good and strong here. And relax. A test like this, especially if it's an acute flare-up of tendinopathy, that would be a positive test because she had pain. Sometimes, even though the client is complaining of pain at the patellar tendon, this test alone will not really give us a positive result. That's why we would go on to do the palpatory exam to see if we can locate any parts of the patellar tendon that are tender to palpation. The palpatory exam for patellar tendinopathy focuses on the attachments all around the patella. The most common place for patellar tendinopathy, or jumper's knee, as we said, tends to be on the inferior distal aspect of the patella. In order to fully be able to palpate the tissue around the patella, we need to be able to get access to it by moving the patella in a sort of a seesaw motion, either up and down. So we've already observed that the patella moves well. I'm going to use the web between my thumb and first finger to pop the patella. So I'm going directly down to the table to bring this end of the patella up to give me access so that I can use the flat of my finger to palpate the edge of the patella. We are looking for the most tender spot. We're going to work all the way across the inferior aspect of patella. Now, one thing to note is that there's a bursa underneath the tendinous attachment on the tibia. So you don't want your palpation to be flat against this because this is going to rub on the bursa and may irritate it. We're really focused on palpating the bottom edge, the inferior edge of patella. Sometimes tendinopathy appears at the superior aspect, so we want to also do the same kind of thing for the superior patella. So again, I've brought the superior surface closer to the ceiling so that I can use a flat finger to palpate all along the top edge. You can continue to do some palpation on the medial side of the patella by pressing from the lateral side over to open up the edge of the patella on the medial side. And the same for working on the lateral edge. For purposes of the camera, we'll come over to this leg. We're going to press the patella from medial to lateral to expose this edge for the palpatory exam to see if there's any discomfort along here. During the palpatory exam, we located the area of most tenderness on the patellar tendon. Since it's typically at the inferior medial aspect of the patella, that's where I'm going to demonstrate the friction work. So once again, we use the web between the thumb and the finger to expose the bottom edge of the patella by pressing down on the top edge, palpate the most tender spot, and then with moderate pressure, we're going to do slow transverse friction across the tender tissue. Working on a scale of about a 7 on a 0 to 10 pain scale. We're going to apply friction for about 30 seconds to a minute. Typically what happens at the end of this minute is the pain has decreased enough so that the client may say something like, "You're not really pressing that hard anymore, are you?" But in fact you are. The friction is just working to reduce the sensation of pain here. So that would be the deep transverse friction application for patellar tendinitis on the medial inferior aspect of the patella. In this part of the video, I'm going to show you the full treatment sequence for patellar tendinopathy. And just for the purposes of the video, we do not have the client draped otherwise except in a pair of shorts. Many sports practitioners work with clients with no sheets or draping. If you use draping, feel free to drape the way you normally would. But for our purposes, we wanted to be able to give you the best view as possible. To begin with, we're going to start with a little bit of lubrication. This is just coconut oil, which is what I use during my treatment sessions. Warm up the hands a little bit. And we're going to start with compressive effleurage through the whole. We're going to start with compressive effleurage through the whole leg. So coming up from the shin, easing up across the knee, and following so that our body weight is over our arms and not reaching from down here where the leverage is all wrong. So starting at the lower leg, coming up to do compressive effleurage, letting the hands form around the tissue, then moving into compressive petrissage. And I'm moving a little faster through this just for the purposes of getting to the actual treatment of the patella. Broad cross fiber work in both directions. Notice that my thumb is moving with my whole hand and not just moving on its own. Some general stripping. And then more specific stripping. We're trying to reduce the overall tension in the quadricep group to take some of the tension off of the patellar tendon. And now moving to the actual treatment of using deep transverse friction. We're going to assume that the tenderness, the injury is at the inferomedial pole of the patella. I'm going to come back so that I can pop the patella. So we're going to use the web between the thumb and the finger to pop the patella to bring the inferior edge up so we can contact the bottom edge with the pads of the finger, maybe a braced finger. And the friction work is done slowly and carefully on the most tender spot. Notice that even though I have lubrication on my hands, I'm not sliding on the skin. We are moving the skin and the tissue underneath together against the bone. This is applied for about a minute. We're checking in with the client to be sure the pain level is tolerable, usually around a 7 on a scale of 0 to 10. And typically by the end of the first minute of friction, the pain has decreased. After doing that, we're going to come back and just do a little bit of kind of make nice on the thigh. And for this treatment, this will be the end of the sequence for patellar tendinopathy.